Hey everyone, thank you so much for joining this video here. Glad to have you. My name is Jonathan Schinkel. I am the owner and primary agent of Health Horizons Medicare Solutions. We are a full service insurance agency brokerage. That means that we don't work for any one company. We represent many different insurance companies across the health, Medicare, and life insurance space. And so when you decide to work with us, you get somebody who actually is going to work for you, not just the insurance company. Previously in my career, I worked as an employee of an insurance company. My wife was an independent broker and realized, that I was limited in my ability just offering one company. And so I decided to jump ship and become a broker and offer every different company that was available. And really, my clients were very happy about that. It gave me the ability to be impartial, to truly work for you, the client. And so we found, here in the channel, producing educational content, our goal is to educate and inform you. It's not to twist your arm to try to get you to sign up for something in particular. Medicare is complicated. Insurance is complicated. This is not like normal health insurance that you may be used to buying. There's lots of special rules, lots of special ways that plans are designed, and hoops that you have to jump through in order to get Medicare and get your Medicare insurance. And so I believe that you will find our content helpful. If you do, give us a thumbs up, subscribe to our channel. And we ask in return, the only thing we ask is that you would consider working with us as an agent to help you through the process of signing up for Medicare. Absolutely no cost for that. No one should ever charge you to work with them. There's no fee for our service. We get paid directly by the insurance company for helping you sign up. Doesn't cost you any more to sign up with us. Prices are the same. You just get our expertise. And a lot of people don't realize that there are local people who are available to help them, that are an expert in all of this. Hoops that you have to jump through with Medicare, each of the plans that are available. You likely have 30 to 40 different Medicare plans that are available in your area. And to navigate that maze, taking into account your doctors, your medication, your financial situation, and your desires, as well as extra additional coverage like dental, vision, things like that, it can really be helpful to have an agent who walks alongside you, helps you to navigate this very complicated process and make the best decision for you and your family in what can be a permanent, lifelong decision, depending on what you choose, where there's certain rules and limitations that can prevent you from changing from one type of plan to another. And that's where our education comes in, is we want to try to give you the best advice possible. And we believe that that will be helpful to you. And in return, we ask that you would consider working with us. We don't just sign people up and never talk to them again. We really do get close with our clients, become friends, stay in touch, help them navigate changes in circumstances, changes in the plans that are available, answer their questions, deal with issues that come up. There's a lot of value that's provided there. Again, completely no cost to you. And so hopefully throughout the course of this video series, again, there's many different videos that we're producing. I believe you'll find, our personality, you'll get a feel for us. We're not pushy, we're not salesy. We really take an education first, consulting, advising perspective. So without further ado, we'll go ahead and get started. Today's seminar is Medicare, what you need to know. And this video is meant to be an overview of the parts, the costs, and your responsibilities with Medicare in order to get started. Further videos will go into detail about the different plan options that are available, different situations like those for veterans, people with the VA or TRICARE, and what to do if you're still working. Should you pick up Medicare A and B? Should you just get A? What does that even mean? We're going to get into that right here. So again, introduction, already went over that. Our promise to you is to give you the best advice and service possible. Contact us to schedule an appointment anytime. Of course, you can download these notes to do this entire course. This is something that we do live, but we do it online as well. And we are fully virtual. We have the ability to be fully virtual if that's what you prefer. We do meet with people in person in Virginia, North and South Carolina. Those are the areas where we have agents in person. And I am, again, the primary agent and the owner of this insurance agency. So today we're going to cover what is here on the screen, all the different parts of Medicare, A, B, C, and D. What is your responsibility with Medicare? What are your costs and obligations that you should be prepared for? How do you get medication, dental or vision under Medicare? And how plans are changing and what to think through when you are choosing a plan and how to avoid the advertising and deceptive tactics and just general bad advice that is out there. Now, if you're new to Medicare, if you're turning 65 or getting ready to retire, you are going to be bombarded by advertising. They are going to knock your door down in the mailbox, phone calls, everything like that. There is just a lot of information that's out there. Some of it good advice, some of it bad advice. Most of it is high pressure sales because there's a lot of money to be made for agencies in this business, those that are just going to churn people into their plans. So we ask, again, just watch out and be careful about who you talk to. Work with somebody who really is an expert, who's a broker like myself. And you're welcome to reach out for any questions or clarification. All right, let's get started. Medicare. Overview of Medicare. What is it? So Medicare is not typical health insurance that you're used to. General health insurance through your employer, even through Obamacare, what we call the marketplace, is a little more easy to understand. Medicare is very complex. There's a lot of rules, a lot of regulations, and it helps to understand where Medicare came from. It came as a law created by Congress, and so it was written by lawyers as law. And that helps to describe or to give an explanation for why it's so complicated. It is the largest health insurance program provided by the American government. It's expected to grow to over 80 million people by the year 2030. So it's a lot of complicated stuff and is expected to continue to change as more and more people are added to Medicare. What are the parts of Medicare? Now, this is something that you can commonly find, but is maybe harder to understand because typical health insurance is not broken up this way. And so there's really no rhyme or reason for it. It doesn't make sense. But for whatever reason, this is the way the government has decided to organize it. The 4 parts of Medicare. Now, 2 are traditional Medicare. Then we call it traditional because this is what is provided by the government. When it comes time to get your Medicare, you're either going to be enrolled automatically if you receive Social Security now, or if you delayed Social Security, you are going to need to apply for Medicare. Now, what you are going to receive through applying for Medicare is a Medicare insurance card. It's going to be a paper card. It's red, white, and blue, and it'll say Part A, hospital, and Part B, medical. That is your government-provided Medicare insurance, known as traditional Medicare. Part A has to do generally with inpatient hospitalization. There are some other things that are included under Part A, like hospice, but we're not going to get into the weeds of that. Typically, Part A is no cost to you if you have met the requirements to receive it at no cost. What are those requirements, you might ask? Well, good thing. You have to have worked for 10 years in the United States and paid Medicare taxes. And this is payroll tax, your FICA, Social Security, and Medicare deducted from your check every month, or if you're self-employed through self-employment tax. This 10-year requirement needs to be met in order for you to receive Part A at no cost. Now, if you were a stay-at-home parent or didn't meet that requirement, but your spouse did and you're legally married, then most likely you will qualify to get Medicare at no cost due to your spouse's taxes that they paid. Now, what are your share of the cost with Medicare Part A? Well, Medicare Part A charges what's called a deductible. Now, again, let's think insurance language. People don't think about this, every single day. It's helpful to be reminded of your car insurance. Parts of insurance, you have a premium. Medicare Part A, as we said, premium free. Premium is what you pay every month to have that insurance. Think about your car insurance or your home insurance, what that premium is. Deductible, that is the amount that is your responsibility before the insurance company pays anything. With Medicare, it changes every year. Surprise, surprise, more complication. Hospital stay, the deductible here in the notes and on the screen, $1,632 in the year of 2024. Again, it changes every year. So right off the bat, whether you go in the hospital for 1 day or 10 days, you're going to get a bill for $1,600. That's your share. Then Medicare is going to kick in up to a certain number of days total. Part B, the other part of traditional Medicare, this is everything outside of the hospital, outpatient care. So think your doctor's office visits, your lab work, different tests, MRIs, CAT scans, surgery, things of that nature. Usually Part B is not free. Unlike Part A, Part B has a monthly premium you must pay every month. Now, there's a standard premium, and that, again, to be complicated, changes every year. In 2024, the standard premium is $174.70. However, this can be higher or lower based on your income. There's a sliding scale. You can get in Google, Medicare Part B premium 2024 IRMA, IRMA. That stands for Income Related Monthly Adjustment. They look back, I believe it is 2 years, not just 1 year, but 2 years on your tax return. We'll look at your adjusted gross income and base your premium off of that, going up all the way, I believe, to $580 per month for Medicare Part A, or for Part B, I'm sorry. $580 a month is the highest bracket. Again, it's per person. Medicare is not family or group coverage. It is individual. So that could be both, a husband and wife, for example, if they are high income, could have to pay as high as $580 per month for each spouse. Now, Part B, in addition to the premium, carries an annual deductible. This year, 2024, is $240. In addition to the deductible, Medicare pays generally about 80% of the cost, and you, as the patient, have to pay that remaining 20%. Now, that 20%, and this is an important feature, there is no maximum out of pocket for the year. And many people with their typical health insurance, they are used to having a max out of pocket or a cap. And that is your copays, your coinsurance sort of add up throughout the year. And then if you ever hit that cap, think catastrophic situation, you're done and the insurance pays 100% the rest of the year for in-network service. Medicare doesn't work like that. Just regular traditional Medicare, there is no maximum limit. So something to be aware of, and a very important reason to add on some kind of secondary coverage. Now, third part of Medicare, Part C. Why they put it in these 4 letters, is confusing, unfortunately, but it is what it is. They call Part C Medicare Advantage. Now, the Medicare Advantage program is a private insurance program through companies that are approved by Medicare to offer plans that are approved by Medicare. And we'll get into much detail in a later video about Medicare Advantage. But all you need to know right now is Medicare Advantage is Part C of Medicare. Now for Part D, this is one that's somewhat easier to remember. D for drug. Part D is prescription drug coverage. Now your red, white, and blue Medicare card, that does not give you Part D coverage automatically. You must purchase a Part D insurance plan through a private company that is approved by Medicare. This would be like Humana, United Healthcare, Aetna, one of these companies that's approved by Medicare. That plan is, if it's individual, Part D plan is most likely going to have a monthly premium. In addition to that, it may or may not have a deductible that you must pay before they pay anything toward your medicines. And it's, of course, going to have co-payments or co-insurance for your medications. And so, again, about 30 to 40 different Part D plans that could be offered in your state. Very complicated. Turn to us for help. Let us help you with checking on your drugs, looking at your situation, what's going to be a good fit for you. One thing to note, I should back up here real quick on Part D, is that Part D comes as a requirement to add on, or else there is a penalty. Now, if you are still working, we'll get into that in a later video, what to do about your employer group plan. Is it quote unquote credible coverage for Medicare or not? But if you get a Part D plan, or rather I say forego getting a Part D plan, and you decide to add one later, that is, you don't get a Medicare Advantage plan that offers Part D, and you do not buy a separate Part D plan. You don't do either of those 2 choices, and you have no other credible coverage. For example, TRICARE or coverage through your job that Medicare considers as good or better than Medicare drug coverage. That's their definition of credible. Your company should let you know if that plan meets that requirement each and every year. If you forego all of those options, you go without Part D, maybe you don't take any medicine, you don't want to pay $30 a month for a Part D plan, and then say 3 years later, you're taking an expensive medicine and you want to add on a Part D plan to help with that cost, Medicare will charge you what's called a late enrollment penalty. And that is very heavy-handed. It's a penalty for life every single month for the rest of the time that you are enrolled in a Part D plan, you are going to need to pay that monthly late enrollment penalty. So this is something that's important to be aware of. I, over the course of my career here, have met several people at different times who have a penalty. It might be $30 a month, $50 a month for the time that they went without drug coverage. And if they need to add on drug coverage due to taking, say, an expensive brand name medicine, it's going to be even more expensive because they have to pay this penalty. So very important to be aware of. All right. We're going to start our second video in just a moment. That is Medicare supplement policy or Medicare Advantage plan. Which one should you choose? Go ahead and click over there. Check it out. Again, if you found this content helpful, give us a thumbs up, like the video, subscribe to the channel. Feel free to reach out and browse our website, send us a message, give us a call, send me an email. You're able to talk to me personally. I don't have a secretary or gatekeeper. You can give me a call, tell me about your situation. I'll give you some advice. Would be happy to work with you. So again, thank you so much for joining today, and have a great week.